Today I'll be giving an overview on the EMT emergency medical technician position, and it'll let you understand if this is the right role for you when pursuing your clinical hours. Now let's start off with what is an EMT. So just a quick overview, they're generally just healthcare professionals that are trained to provide emergency medical care. So you'd be the one that would typically be the first responder during medical emergencies, accidents, or disasters from the day-to-day life. Some of the general skills that are kind of required for this position would be quick decision making under high pressure situations, strong communication skills, endurance such as physical stamina and resilience, and then also, of course, compassion and empathy. So this will give you a general understanding of what the position typically does, and then the skills that come along with it that are also needed to be successful in this role. So let's go into some general roles and tasks if you were an EMT. So to begin with, you'd be doing the first responder patient assessment, which is just checking on their well-being in the first place and assessing what they need at that time. Next would be BLS, or also known as basic life support, which would include CPR, oxygen, or other non-invasive treatments that you could provide on the spot to assist them with their ongoing ailment. Next would be emergency transportation, where you're bringing the patients from wherever they're located to a safe medical facility such as a hospital nearby. And now you'd collaborate with the healthcare team at the hospital, working with the paramedics, the nurses, and doctors to transition them from care in the EMT truck back into the hospital. And lastly would include extensive documentation of everything you've interacted with the patient. So that would be their condition, any interventions, drugs, or treatments that you administered for the patient. An overview of the hourly wage, it would typically range from $14 to $25. However, it is highly dependent on the state, as some do pay more than others. And 12-hour shifts are quite common, so this would include either nights or weekends or holidays. So the shifts are definitely long, and it's something to keep in mind when pursuing your EMT license. Now, how to become an EMT? So we split it up into 4 steps, and let's begin with eligibility. You must at least be 18 years old, hold a high school diploma or a GED, and if you're in college, that means you've already completed both of these. You have to be CPR certified. A lot of the times these courses will get you that CPR certification, and you won't need to get it from another place. And lastly would be vaccine records. So these have to match the local EMT clinic that you are working out of, and that is definitely a base-by-base incident that you could check up on. Next would be to enroll in a EMT program. You can just easily Google these in your nearby area, or we've also compiled a detailed sheet with some examples of specific locations near you in your state that you can enroll in that are approved, and I'll also give you an outline of the program duration, which typically is 2 to 4 months. And the 2-month programs are accelerated and definitely require almost 40 hours a week, while the 4-month periods are a little longer, but still, both these forms of programs require a lot of intensive commitment. Now, the cost typically ranges from $1,000 to $3,000. These are definitely not incredibly cheap. However, you do get your license as part of it. A lot of the licenses that you might need for your role are included in this one course. So the cost ranges very highly on the state, the program you're doing, and the duration of the program, as accelerated programs will cost more than long-term 6 to 9 month programs. Third would be to pass the NREMT, and this is the examination to get you your license. And it has a cognitive and psychomotor component of the test. The exam fee ranges from $80 to $115. Some of the exam fees are part of your program fee. So again, depends on the program. And the passing score is higher than a 70%. Lastly is your certification. So after you've completed steps 1 through 3, then you could apply to your state's EMS, and they will have all the certification that you need for the job located in your state. And you'd be required to provide all documents such as your your EMT license, the passing test, your vaccination records, CPR certification, etc. Lastly, the fee for your certification would range from $75 to $150, again, highly dependent on the state that you're located in. Now, let's take a look at the challenges and rewards of being an EMT. So let's just begin with challenges. So stress and burnout are definitely prevalent, especially because you're working a physically and emotionally demanding job. There are irregular hours and high stress environments. Like I mentioned earlier, it's typically 12-hour shifts. You're the first responder in these medical cases, and they do tend to be emergencies. Now, it is a high commitment throughout the course and on the job, as during the course you're committing 30 to 40 hours per week, and you do also need to pass the exams, get licensed, so it is a tough process. Lastly, it is difficult to balance on a full workload if you are doing this during your college years. So taking a 15 to 18 credit semester on top of working 20 to 40 hours, doing 12-hour shifts can get very draining. But let's move on to the rewards. So when you're applying to med school, it can really demonstrate adaptability or your ability to handle high stress and unexpected challenges, since this is a pretty predominant part of the medical field, and you've already shown your ability to deal with some of these circumstances. Second is you would have direct exposure to patient care and emergency medicine. You're the first responder on a lot of these cases, and you work directly with the patients and also connect them back to the hospital. So you're there for a lot of their medical journey. Third is working under pressure. This job is one of the most high intensity, high pressure jobs you can do while being pre-med, and it definitely shows your ability to work well under these high pressure conditions. And lastly, of course, is you're providing life-saving interventions for a lot of these patients that you will be receiving first. Before they can be transmitted to the hospital, you complete the first assessment and their first interventions or treatments, which can be completely life-changing and saving. Now that I've completed the general overview of this job, we have some additional resources you can look into if you're interested and think this is the right fit for you. So first, we have summary sheets, which give a really specific and general overview of each clinical role. So the summary sheet is the general, while the detailed document has specific training programs and hospitals in each state that you could apply to and potentially work for yourself. Lastly, feel free to email, DM, or reach out to any of us with additional questions about this position and maybe where you could find resources to apply. Thank you.